Okay, then we move on to number C. Resolution to authorize Sawyer County Health Department to become an environmental health agent for the Department of Agriculture, Trade, and Consumer Protection.
I make a motion to approve.
Motion by Mr. Paulson, second by Mr. Duffy to approve. Discussion, yes.
There's a couple of discussion points on this. It appears when this was presented, it was a package deal that the drinking water laboratory testing went along with the environmental health aid in order for it to be a budget neutral item. So I guess one of my questions is, I'm really concerned about the drinking water laboratory services. I think it's a really good concept and it's a great idea, but in talking to people and doing research, I don't think you're going to get additional that was talked about in Health and Human Services, 500 personal property owners, who own houses or whatever, to come forward and get their water tested on a regular basis. Services are all over the internet for water testing at a cheaper price than what the county is proposing to do this for. So I think it's unrealistic when you look at the projections to project the amount of revenue that's coming in related to water testing. Having said that, I think the sanitation portion of this is extremely important. We have resorts, restaurants, et cetera, that are not being inspected on a regular basis because the state does not have the resources or the ability to do that. I guess my question is, can we do one without the other? And I'm saying that because it appears the positions and the funding for the positions is split between the two services. So is it possible to hire one person, and can one person actually perform all of the testing that's needed related to the sanitarium? I think the part discussion with that was, no, they could not. So that's my concern, before we pass this, that we look at the second portion of it, which is the water testing. It appears they go hand in hand. So to pass one without the other, I think could have negative budget implications, and that's fine if that's what we want to do. But I do think we need to have a discussion on both of them.
That is the reason that we put two separate resolutions, is because you can do one without the other. And that is possible. We did put the budget together based on the state rates and the number of facilities that we have, and 2 employees doing those with some possible summer help. So, we think there are advantages and economies to do both of those programs together. As you say, it does certainly help the budget. The Agent of the State program can stand on its own without the water. It may not be able to stand on its own at the state rates. We tried to develop the program so that we could do it for the same fees that the state is providing. Again, those state fees are a statewide fee that are an average of what it costs them to perform those services. In Sawyer County, obviously, we've got a lot of entities spread out over a large area, and there's maybe some more travel costs that they have in urban areas. So are our costs higher when we try and do it ourselves? Perhaps. But we try to accommodate that program with the existing rates just to show you what it may do if we do it in that fashion. We've also got James Kopanek from the state here to answer further questions about those things. Eileen, our public nurse, of course, can answer questions, and Matt McKay as well. But that's my introduction to the topic anyway.
Yes.
Tom, is that the same thing that we were talking about for the inspectors for this short-term rental housing? Is this a different inspection team, or is that the same thing?
That would be part of this program. Lodging facilities, whether there's tourist rooming houses, motels, are part of the program. Yes.
Thank you.
Any other discussion?
Yes.
Yes.
So the fees will remain the same as what the state mandates?
That's what we proposed in the budget. You know, we can look at those fees. You know, if you want to do the water program, I think we can do that with the budget that's presented. If you don't want to do the water program, then maybe we need to take a look at that. I mean, either we are using the state fees and generating that revenue, and would that generate a deficit that would need to be funded with tax dollars? That is an option. The other option is setting the fee to balance the expenses on that program. So you've got an option of what it is you would like to do if you, in fact, want to do that program.
Mr. Bass?
If we're thinking about actually doing the water test, I 3, 4, 5 months ago, had to have my water tested in my house, and I did, I don't remember, Dale, 15 different kinds of tests on it, whatever that, all short of the uranium one. Is that what we're talking about, that same thing? Is that? So we're gonna build a laboratory?
It's not that hard.
You gotta agree.
I just said, maybe we should bring up the state.
Okay. Excuse me. Yes. I'm Amy Sinek, I'm the Sawyer County Health Officer. And just to speak a little bit to the program, to answer the question about the lab testing, that is, what we're talking about is looking at doing coliform and possibly nitrate in the future. We're not sure if we're going to be doing nitrate. Not the metals, the heavy metals that are often done as part of homeowner packages, or we also have them for infants and pregnant women that include the metals. So what we're looking at is right now the coliform for sure. And one of the reasons we are looking at the water program is of the programs I've spoken to, the health officers, who all support that we would become agent. There was not one of the health officers that I spoke to that did not say this is a good thing for your community. It's basically the beginning of an environmental program. So right now you have the licensing and inspections being done through DADCAP. The DADCAP program has an electronic program, Health Space, and one of the roles of public health is to monitor and surveillance of health of the community. As an agent of the state, we would have access to all that information. Right now, we don't. The water testing is often seen as a great idea for a community to add to this environmental program because your sanitarian and their assistants are going out to these sites and they can do the water collection as part of that program. But right now, we're really looking at E. coli and potentially nitrate testing. And I think if people have a concern about their water in our community, we need to, they don't always get that kind of testing. We do the labs where they go out to the state, and oftentimes they come back and forth with mail, they don't get there in time, and get these too old, and people have to retest, so it's not really all that convenient to be mailed out to be tested. Is there any other questions that you would like me to speak to? Yes?
I'm concerned that everyone should have clean, safe water to
Right.
drink and bathe in.
Right.
Most people get their water tested by a private firm. If we go ahead and authorize this, I can see the public getting their water tested in volumes, and we're going to be saddled with a huge bill at the end of the year.
Well, Ashland is pretty successful in how they've been able to blend these two programs,
And we
and
don't know right now what it would cost.
No, we don't.
You know,
they're actually
that's
very
my concern is the
Yeah.
money.
right. But combining it with the inspections and actually the beginning of your environmental program. Right now, I'm basically your environmental program, and bringing in someone with ability and expertise. I've told Tom this. I was like, I'm your environmental program. We're a little limited in our capacity, and we connect with the state, and we work with them. I have a problem with lead or something. If we need a lead inspection, I would have to contract with like Marathon County to come in and do that kind of work because we just don't have someone in our community that can do that. So these are some of the things that this environmental program is. Inspections is seen as something that doesn't go away. It's always there. These things have to be done. It's very important for us to know what's going on with these environments, and I can tell you some stories about the calls I get where, complaints about a variety of locations, especially during tourist season, and I send my email to DATCAP and I don't necessarily have to communicate with them. They're very good about responding, and if I ask them to hear back, they'll talk to me, but they look at one piece of the puzzle. They're looking at the inside of a building, maybe they're not looking at the outside. Having the capacity of the sanitarian and environmental program is going to help overall in your community to deal with things like meth labs, garbage, nuisance things that right now you have me basically sorting through and trying to fix them, as well as being the WIC director, birthday director, and public health supervisor. It's just building capacity to have a better environment. And I know there's people in this room that have had phone calls to me, and we do the best we can to get through the environmental issues, but as a health officer and not an agent, you're basically dealing with human health hazards that really rise to the level of a huge problem.
In the budget for water testing, are those just the establishments that we're going to inspect?
Well, Ben has done a really good job putting the budget together, and he has a combination of those sites that we would inspect and require water testing, and then we anticipate some private citizens that might have their water inspected, and then there's a contract with the DNR that if you do, work with them and help them complete some of their work, it's called these surveys that you can do. It's another piece of the puzzle. These are things that do not go away. So it's not like a grant that in 5 years is going to be gone. These are established programs. They have to be done. They're not going away.
So would we require, as a part of the inspection for, say, a bed and breakfast, that they do their water testing through us? Do we have the ability to do that? Because what if we say we're going to charge $50 and they say, well, I've been doing it for years for $18, I'm not,
No, offhand, I'm not sure, Kathy, but when you're an agent, you would do the water collection, and I can't speak to whether we have to actually require that. It's probably more, it actually should appear to be a convenience for these people to get everything done at one time. And I know we had at the public meeting, someone who has like 17 wells said how efficient it was. Bayfield County is actually doing it for us right now. The gentleman came in, collected everything, realized that there was something about the way he collected it, came right back and took care of it. Pete up in Bayfield did a very nice job for them. And that's the kind of service we would anticipate giving people in the inspection when we're doing the water program.
To answer your question, though, I don't think we can require that. It is a matter of convenience. It's not we can require people to do
as
that.
long as the inspection is done, it can be done by any
Correct.
agency.
Yes.
Ladies before
Ladies
gentlemen.
first, I just have to say.
Make up your mind, you go.
So doing the water inspections, that's through free enterprise, other places do it.
Other places do it, but one of the benefits of being, that we're looking at is actually a public health role, which is to monitor and collect data on your water in your community. And so right now if they're done at different locations, such as Oshkosh or a private lab, there is no database for that water. And one of the benefits of
Would it be a problem to request these establishments to give you a copy of their water test?
I'm sure they would be able to do that.
Yes.
I'm sure you can ask for that.
Yes.
Mhm.
Mr. Roy,
Yes.
I have a friend who put in wells, he put my well in. And he probably has many years of experience in this, and he's sitting there quietly, and I know he should address this, and I know he could. I'd like to hear your opinion, Dan.
Water testing, collecting samples, doing the test collection process properly, you're not going to do it for the money involved that you're talking here. Sending somebody out 40 miles, collect the sample, you've got to run the faucet, install the faucet, let it run, collect the sample, bottle it, take down the details, get it back here, hopefully in time to get it to the lab, so they could test it that day, because otherwise, if it sits overnight, if it's more than 24 hours, you have to go collect another sample, 40 more miles out, 40 more miles back. Some of them are handy, yes. I think it would be, I wish this had been in place when I had my business. We were sending out anywhere from 2, 3, 4 to 6, 7, 8 water samples a day. I would have loved to have just driven down to the courthouse and had those taken care of. But my biggest problem with this is, if I look at this proposed projected budget here for this process, this entity, these numbers, no, you're going to have to increase these, what you're going to be charging. I'm 99% positive of that. And that's one of the reasons I'm not real thrilled about supporting this. I don't believe you have enough people in mind to collect all the samples, do all the inspections. The inspections take longer than what you think, folks. I mean, it's pretty detailed. If we are going to do this, I would like to see a more realistic potential budget for the entity. And I'd like to see that include more than the sanitarian and one assistant. I just don't think that's going to fly.
Just to clarify a few things with regards to the water testing. So what we're looking at doing is primarily the bacteria testing. And the reason why we want to do bacteria testing and get as many samples we possibly can for Sawyer County residents. One is the test that is recommended by everybody, the DNR, BAGCAP, for facilities, private wells to be done annually. Unfortunately, most of us are not doing that. And there's issues, and the reason we want to do this is that we can provide the service, provide the test kits. We can do the bacteria testing here because that is the one that is time sensitive. So the reason why we feel this is important for our residents is that they don't have to go through that inconvenience of coming here, getting the test, pay $3, okay, go back, go home, take the sample, come back into town and get it submitted into the mail by 1:30 and pay that overnight fee to get it there. It's the bacteria test that's causing people to have to rush this test. If we're able to provide that test here, they can bring in Monday, Tuesday, Wednesday, probably up to Thursday. We can test for it here as a 24-hour test. We can have the results for them the next day. That's for bacteria. The other part of what we're looking for is doing the nitrate test. Nitrate test we would send out to UW Oshkosh, where they would conduct that test. And it's not only nitrates, but that would be one other test that a homeowner would be likely to test for. But there's also other tests. I forget if you had, Mr. Bassett, you had your water tested here recently. Did the home owner kit and had several things tested. We would still be able to do that. We just wouldn't necessarily do it here. We would send that out to UW Oshkosh as well, where we would get those results in a timely fashion. I've been in communications with the director of that program down there at the UW Oshkosh. We can also work collaboratively with real estate agents and those home inspectors that are inspecting homes and getting water samples for the sake of transactions of realty, property. And so if we had the means of doing something that here, we can save some of that headache of them having to get to the post office at a certain time. We could do that bacteria, the time-sensitive one, and then at maybe, if folks aren't necessarily in a hurry, we can get that, we could do every couple days, we can send out those samples and get them down where they don't necessarily have to run and get to the post office by whatever time. And so there is many benefits to doing this. Also, as far as going out and getting the sample, this is why we're trying to do it in conjunction with agent of the state, is because we have somebody out there at those facilities who are required to have bacteria and nitrate samples annually. Part of the TNC, transient non-community water testing. So those facilities that serve the public in some form or fashion, maybe it's a restaurant out in the country that have a private well, they have to have their water tested. It just makes sense that we have somebody there already versus them paying somebody else to come in and get that water sample. I believe most of them currently have that inspector get the water sample taken for them while they're there. And so it's a time-saving process, and we can get that sample out as, you know, we can get it here, do the bacteria test, send it down to the rest of it down to UW Oshkosh for the nitrate testing. So that's the reason why we're putting these together. So in that budget, we not only have private wells, individuals that are having water tested and nitrates tested. We also are working with the Department of Natural Resources, like Eileen said, where we work with them to contract out water testing for those TNC properties that have to have a survey done every 5 years. So we're going to be out working, getting those samples, doing those surveys for those facilities once every 5 years. So in the course of 5 years, we will do that survey for the DNR and get all 100% of those facilities tested and surveyed. So the other importance of this water testing is right now, we are with the program that we currently are using, we have somewhere right around 100 private wells that are testing their wells for bacteria or doing a homeowner test. That's a real small sample of the probably 10, 12,000 private wells that are out there. And we need to, yes, for the most part, our water is good and it's safe here in Sawyer County. We want to keep it that way, but we don't know what's going on with these heavy rains that are happening annually. We've seen increase in bacteria and E. coli tests. Okay, so we want to be able to provide that service here when we have these type of major events that are going to be happening more and more often. We can provide that service and have a better idea of what's going on with our private wells in the community and out in the rural areas to build that database to see what's happening and ensure that our water stays safe. Okay? Thank you.
Couple questions. The testing of the water, is it a requirement currently?
I'm sorry?
Is the testing of the water required currently?
For your TNC properties, those are the properties that are have private wells and that are serving the public in some form or fashion. Yes.
Okay. And the cost of the county doing it versus the cost of the owners doing it themselves, what's the comparative there? Is it?
So I mean, the owners are already having it done when the inspector from the state comes in, gathers that water, does that inspection.
No,
I'm sorry?
that's not the way it works. I'm sorry.
And what
The establishment provides a copy of the water test to the inspector.
Okay.
Mr. Slater, do you have a question?
Yeah, what's the process, procedure, if you have a positive result for E. coli?
For E. coli, and then we would work with that landowner to resolve the issue.
What procedure, process is that?
Well, that's what we work with in conjunction with the DNR and getting certified, going over those procedures with that landowner.
Okay, the first step would be to retest. The second step would be, because there are a lot of false positives, the second step is to sanitize the well. And you'll have to have at least somebody with a pump installer's license to do that. It goes on from there. Again, not an inexpensive process.
I think we're here to discuss the resolution. I'm sure that we'd all like to take them outside and kick his butt, but we should keep it to what we have in front of us. Speculation on how this is going forward, I don't think it's a fair analysis. I think it's becoming inflammatory. We either can approve this or not. And I think that the discussion was done at the public hearing. It was vetted at the committee level, and we have the information going forward. We're going to, draw on conjecture. I think that deteriorates for the conduct of the meeting.
I just have a question then. If this was to be just a sanitarian position, could it be done with one individual?
Didn't Tom say 2 earlier?
Would you want me to speak to that?
Yes.
There's 607 establishments. I don't think one person can accomplish that. We probably see that it, depending on the complexity of it, there's some facilities that are very complex, like hospitals, schools, grocery stores, but you would need two persons. You might have a technician, assistant, working with the sanitarian, and we would anticipate working with universities. We have interns that are working to become sanitarians. Might be a possibility in the summer. People often, other programs will do that. Because a lot of the establishments are only open at certain times of the year, so you do need to bring in some assistance with that number of establishments. Thank you.
The item before you is to become an agent of the state, and we do have James Klepanik here from the state, and he might be able to shed some light on other counties that have gone through the process or other things if you had questions of him.
Yes.
I just have another question, because I heard in the background at a meeting after we discussed this, something about an ordinance. So once we become agent of the state, do we have to have some type of ordinance in place relative to this? Because that made me a little nervous on the back end when we started talking, like we're going to do this, but then there's an ordinance coming. Is there an ordinance coming?
Yes. Yeah, there are ordinances that we would have at the local level that authorizes us to be an agent of the state and do the things that the state requires us to do. So we would make that an ordinance. And so that would be the next step in the process if you wanted to move forward with that.
I'd make a motion to approve.
We already have one.
You already have one?
Yeah. In a second.
Your turn.
Any further discussion? Hearing none, all in favor of the motion?
Aye.
Opposed?
Aye.
Roll call, please.
Vote. Okay. Carol?
Okay, start with Captain McCoy.
Yes.
Reed Schumann.
Yes.
Iris Humphries.
Aye.
James Schlenker.
Yes.
Mark Howard.
No.
Thomas Duffy.
Yes.
Bruce Paulson.
Yes.
Brian Bissonnette.
Yes.
Elaine Nyberg.
Yes.
Jim Bassett.
Yes.
William White.
No.
Ron Kinsley.
Yes.
Ron Buckles.
Yes.
Ellen is on.
Motion carries. Thank you.
Does Dale get his vote?
And Dale, you're in the top.
You're at the top. Oh,
Yeah.